I am Dr. Benny Panakal, Senior Consultant Interventional Cardiologist. Welcome to Heart Talk. When we are doing procedures to remove the blockage in the coronary arteries, these days the gold standard is to put a metal stent, drug-coated stent, and remove the blockages. But there are certain inconvenience and problems with this kind of peculiar treatment option because you are leaving a foreign material inside the artery, namely the stent, which requires blood thinners to be taken for a long time, and in certain situations it can cause bleeding, and risk of bleeding is small. This is a little bit of problematic. But now there is a method called Metal-less Angioplasty using drug-coated balloon, which is becoming more and more popular, where you are dilating the blood vessel and putting a drug-coated balloon with a polymer which releases the drugs slowly into the arterial walls. It will prevent from producing the blockage again, but you are not leaving any metal mesh inside. The advantage of this situation is that artery is almost remaining normal. It can resume its functions, as well as the need to take blood thinners for a longer time is avoided, thereby reducing the risk of bleeding. This is the gold standard. That is the thing that is going to happen in the future in most of the situations after proper preparation of the blockage by reducing the calcification, dilating the blood vessel by using various methods like cutting balloons, scoring balloons and all. And you put that drug-coated balloon and dilate it properly. So that's a very, very good option.